It's been almost a week since the president signed an executive order invoking the Defense Production Act, which lets the administration force private companies to make critical items to fight coronavirus, like ventilators, masks, testing equipment. But it's still unclear whether that's actually happening. This morning, the president tweeted the act is, quote, in full force, but said he hasn't had to use it because, quote, no one has said no. But the head of FEMA said they would be using the DPA for the first time today to get test kits. FEMA is also sending equipment to hard-hit areas like New York, but the governor there says it's nowhere near enough.
FEMA says we're sending 400 ventilators. Really? What am I going to do with 400 ventilators when I need 30,000? You pick the 26,000 people who are going to die because you only sent 400 ventilators. Where are the ventilators? Where are the gowns? Where's the PPEs? Where are the masks? Where are they? Where are they if they're doing it? When we went to war, we didn't say, any company out there want to build a battleship? Who wants to build a battleship? That's not how you did it. The president said it's a war. It is a war. Well, then act like it's a war.
Here in Massachusetts, where we now have 11 coronavirus-related deaths, as non-essential businesses officially shut down today at noon, and a stay-at-home advisory went into effect this afternoon as well. Governor Baker expressed some frustration about the federal response as well. When asked about whether he'll support any kind of state economic stimulus package, here's how he responded.
It's very hard for states to make decisions if they don't know what the feds are doing. Cities and towns feel the same way, which is why it's so important for the feds to decide what it is they are going to do and to do it.
As for the president's focus, well, here he is at a Fox News virtual town hall just this afternoon.
I would love to have the country opened up and just raring to go by Easter. We lose thousands and thousands of people a year to the flu. We don't turn the country off. We lose much more than that to automobile accidents. We didn't call up the automobile company to say, stop making cars. We don't want any cars anymore. We have to get back to work now.
And not only is he not alone, there are apparently some who are willing to die to keep the economy up and running.
No one reached out to me and said, as a senior citizen, are you willing to take a chance on your survival in exchange for keeping the America that all America loves for your children and grandchildren? And if that's the exchange, I'm all in. I just think there are lots of grandparents out there in this country, like me, I have 6 grandchildren, that what we all care about and what we love more than anything are those children. And I want to, live smart and see through this, but I don't want the whole country to be sacrificed.
Did he actually say that? Thankfully, others are offering up help that might actually do something to address the crisis we're facing down. One of them is Tufts President Anthony Monaco, who joins me via Zoom. He's a former professor of biology and neuroscience at the school. Welcome. Thanks so much for joining me. I appreciate it.
Pleasure to be here.
Your predecessor, who is currently president of Harvard, Larry Bacow, announced today that he and his wife have tested positive for coronavirus. Does that bring it even closer to home for you?
Absolutely. When a president gets the coronavirus, you know that anyone can get coronavirus. I think it's quite a symbol.
Your op-ed, your call to your fellow presidents, which has gotten nationwide attention, is urging them and you to help relieve this stress on the healthcare system. Among the things you're suggesting are repurposing, for example, residential units at places like Tufts to serve as virtual hospital rooms. Could you flesh that out just a little bit for me and tell me what kind of response you're getting from host communities like Medford, Somerville, and beyond?
Sure. As you've seen the scenes in Italy, when there's a surge on the hospitals and they can't manage the number of patients, they're using makeshift tents and parking lots and hallways to manage this large overflow. And seeing that coming, I felt it was important in listening to the needs of our hospitals to prepare our campuses as alternative treatment sites when that surge happens. So we've been working with Tufts Medical Center in our cities of Medford and Somerville and other providers to consider ways in which our dorms can be utilized to house medical personnel who don't want to bring that exposure risk back to their families, to house patients who are not COVID positive but can be dealt with low-level medical or physical therapy type rehabilitation treatments. That helps hospitals free up space for COVID patients that need critical care. And another way we can help hospitals is that their COVID positive patients who are recovering, who have now very mild or no symptoms, could be moved to an alternative treatment site to wait out the rest of their isolation so they don't go back to their family unit and potentially infect other members.
It seems to me that your approach is whatever we can do. I mean, I also read that some of your staff and students were helping repair 6,000 rather old masks, N95 masks, where the elastic had become, brittle. When I was reading about you, I read that you were a medical student at Harvard, I think it was, during the AIDS epidemic. And I'm wondering, did dealing with isolation issues there and concerns about being overrun by an epidemic, is that in some ways informing where you are on this in 2020?
Obviously, the AIDS epidemic had a different course than this type of pandemic, but at that time, the hospitals didn't even understand the course of transmission. There were no treatments. They were worried about large numbers and that they wouldn't be able to manage. So I understood, being on the inside, even as a student, the kind of tension and worry and the preparations they were making to deal with such a possibility. It didn't occur. But what I did learn that at that time, many individuals who were shunned by both society and government were isolated in hospitals. And myself and other medical students and many of the medical staff spent a lot of time talking to them. Isolation is difficult. And although we might be physically isolated now, I don't think we need to be socially isolated in the sense of reaching out to those that are self-isolating or quarantined and helping them get through that period.
I don't know if you're calling what you've done a challenge to your fellow presidents, but I'll call it that. What kind of response are you getting? I assume you're speaking to some of them. Are they sort of signing up for this mission?
I think most of them understand the need. They're trying to evaluate right now the security and education of their current students, which is a big challenge, of course, and that's our primary mission. But many of them now see the need of the hospitals and the possibility of using their campuses. And we've been offering logistics advice and other mechanisms to help them set this up.
So you're optimistic that there's going to be, I think I'm reading into this, widespread embrace of this role for universities.
Yes, I think people, right now we're doing it at the local level because we don't yet have a state plan for alternative treatment sites. But I know that the state is looking at this because it's an obvious choice, not only universities and colleges, but other public and private buildings that could be used as alternative either testing sites or treatment sites. So I'm sure it's in their menu of options. We've just been focused on this approach to see if we can come up with a model that works here that other universities could quickly adopt.
You mentioned a minute ago your primary mission, which is obviously educating students. Am I right that you moved to remote learning? Is it tomorrow?
Yes, they start tomorrow. Most of them are using the technology we're using right now for this interview, which seems to be up to the challenge.
So far.
All of our faculty are working hard and we'll start tomorrow.
How apprehensive are you about this? I know that remote learning is not as new to you as in a couple of minutes I'm going to speak to Brenda Casilius, the superintendent of the Boston Public Schools, K through 12. This is fairly new. Are you apprehensive about the breadth of what you're trying to do come tomorrow?
Well, I'm apprehensive, of course, and there's going to be some niggles here and there. The students need to be patient, but our tests so far have been good. And as I said, I think the technology is up to the challenge.
So you were a senior in college once, and I was a senior in college even way before that. What do you say to those kids who essentially are having something taken away from them, which I would assume you would agree was one of the most important and best times of your life? What do you say to those students and their parents?
Well, they're disappointed, and so am I. I mean, the time-honored traditions leading up to graduation for seniors and then graduation and commencement and all its ceremony is part of the experience. And we are now having to come up with innovative ways of doing non-physical commencements to engage our students and their parents to make it a meaningful experience.
Does it also complicate your admissions, I would assume?
Well, yes. I mean, you have to, come up with virtual tours. There's all the things that we're going to have to do about the difficulties with students getting their testing done. Lots of just practical logistical issues. And then the question is, are we going to be through this by fall? It's a big question we're all asking ourselves as we plan ahead.
Anthony Monaco, could you take the last 30 seconds and speak to your fellow presidents who might be watching and make the case that they should take the same path Tufts is about to take?
It's a big undertaking, but it's certainly feasible, and with the right advice and the right partners with your city and healthcare providers, it's a lot easier than I ever expected. And I would encourage you to do this because this is a need that is now apparent, and it will become even more so in the next couple weeks.
I encourage them as well, and I thank you for what you're doing. Anthony Monaco, thank you so much for your time. I appreciate it.
Pleasure.
Anthony Monaco, president of Tufts.